Today's lesson is dementia a mental illness? This is a very hot topic that is debated by many healthcare professionals over the last decade or so. The healthcare industry has made a strong effort to educate the public about dementia and mental health. However, there's still a lot of misunderstanding about both topics. To the public, dementia resembles some signs and symptoms of various mental health conditions, and they would be right. In fact, depression and apathy is often one of the early symptoms of dementia. So it's no wonder there's confusion. The American Psychiatric Association in 2013 updated the Diagnostic and Statistical Manual of Mental Health, which is called the DSM-5, to address, is dementia a mental illness? The DSM, or the Diagnostic and Statistical Manual of Mental Health, was developed in 1952. It is the first official manual of mental health disorders, and it was designed to be used by healthcare professionals. Updates have been made to the DSM over the last few years. The most recent update was in 2013, and that was the 5th edition. And in March of 2022, a text revision for the DSM-5 was published. The most recent version of the DSM-5 actually answers the question, is dementia a mental illness, by identifying dementia as a neurocognitive disorder. What the heck does that mean? So what is a neurocognitive disorder? It is a general term that describes a decrease in mental abilities due to a medical disease other than a psychiatric illness. These disorders are grouped into 3 subcategories. The first subcategory is delirium, and this is a sudden onset of severe confusion due to rapid changes in brain function. This may occur with a physical or a mental illness, and delirium is usually temporary and reversible. And people with dementia may also develop delirium. The next DSM-5 subcategory is mild neurocognitive disorder. Big word for a person with this disorder suffers with decreased mental function and abilities. However, the individual is still able to stay independent and perform daily tasks. And the last DSM-5 subcategory is major neurocognitive disorder. Those that suffer with major cognitive disorders have decreased mental abilities and have lost the ability to do daily tasks. In fact, major neurocognitive disorder is now known as dementia. So, dementia is now characterized by healthcare professionals as a major neurocognitive disorder in the DSM-5. There is still an ongoing debate between scientists and physicians as if this change was helpful or not. Dementia and mental illness look very similar, yet they are very different. There are several mental illnesses that cause symptoms that imitate dementia. Just as Lewy body disease or another form of dementia could be mistaken for a mental illness. In fact, Lewy body dementia is often misdiagnosed because the signs and symptoms are mistaken for a mental illness, such as schizophrenia or bipolar disorder. This is one reason it is so essential to get a comprehensive evaluation or workup to get a proper diagnosis from a medical professional. A comprehensive evaluation actually rules out causes of dementia. That would include ruling out mental health disorders as well. Let's discuss what's the difference between dementia and mental illness. Dementia is a category of symptoms that include memory loss, forgetfulness, difficulty in understanding language, and impaired judgment. There are over 100 types of dementia. The early stages of dementia may vary depending on the cause. As dementia progresses, the mid to late stages of dementia all seem to follow a pattern. Mental illnesses can cause hallucinations and delusions, but that's not usually present with Alzheimer's disease, but definitely can occur in Lewy body's dementia. Dementia is characterized as a progressive disorder. Changes occur over time and decline is inevitable. Those suffering from mental illness usually have intermittent episodes of decline or exacerbation, and these episodes eventually end. The key to understanding the difference between mental illness and dementia is to recognize that they are two different types of illnesses. Both mental illness and dementia have some similar as well as some unique signs and symptoms. As I mentioned earlier, dementia progresses slowly over time. It causes memory problems, changes in language skills, loss of ability to reason or make decisions. Over time, a person with dementia will have some behavioral challenges. There are several mental illnesses that mimic the early stages of dementia. These include anxiety disorders or panic attacks sometimes, bipolar disorder, and schizophrenia. These conditions cause difficulty in thinking. Healthcare professionals categorize cognition or thinking abilities into two categories, mild or major, as I discussed earlier. The severity of the signs and symptoms is determined by assessing the severity of these symptoms. Challenges with planning, making decisions, ability to concentrate, memory abilities, assessing both long and short-term memory, and maintaining appropriate behavior around others. It is important to note here that dementia, like mental illness, may occur as a result of abnormalities of the brain. This may be caused by a neurodegenerative disease or chemical imbalance, or as a result of a brain injury or the damage to the brain caused by a stroke. Is dementia a mental illness, or is the mental health symptoms a type of dementia? Getting a proper diagnosis is important on several different levels. Early diagnosis and treatment for dementia can actually slow the progression of this disorder. If the cause of dementia is a reversible type of dementia, early treatment can actually reverse the symptoms if caught in the early stages. Reversible types of dementia include vitamin deficiencies, brain tumors, and even alcoholic dementia, to name a few. If you or a loved one are concerned they have the early stages of dementia, the first thing to do is see your primary care physician or PCP. Take time to discuss your symptoms and concerns. Your primary care physician may start the evaluation by ordering some lab work. This may include blood tests and a urinalysis. Your physician is trying to rule out other causes of memory problems, such as a urinary tract infection or vitamin deficiency. I'm going to take time to give you a caregiver tip. Seniors that have a sudden onset of confusion may have a urinary tract infection. The aging seniors don't always have the classic signs of a urinary tract infection or UTI. For many, the first sign and symptom is mental confusion. Never hesitate to get a sample and have it tested for a UTI should your family member have a sudden change in their mental status. Your primary care physician may refer you to a neurologist, a neuropsychologist, or a psychiatrist for testing to get an accurate diagnosis. So what kind of test can you be expecting? The initial appointment will include a physical exam. There will be questions about your medical history and your present signs and symptoms related to memory changes or changes in your personality or mood. Because many seniors are not aware of some of the signs and symptoms they are experiencing, it is suggested you consider bringing a family member with you. Apathy and depression are very early signs of dementia. A family member may help the doctor have a better understanding of what they have observed. Your family history is so important as a part of this evaluation. If you have a family member diagnosed with any type of dementia, that needs to be discussed with your primary care physician. The type of dementia is also important to help get an accurate diagnosis. If you have a family member with a history of Alzheimer's, the good news is now there is a blood test that can identify the biomarkers and give you an idea if you are a candidate for developing Alzheimer's disease. I'll be honest with you here. I don't have confidence that a primary care physician can make an accurate diagnosis of dementia in a timely fashion. Our present Medicare system only allots a 15-minute appointment for a doctor's visit. Your primary care physician can order lab tests and evaluate them. They really do not have the time or the expertise to do the cognitive testing that should be done. I believe that every person over the age of 50 years old should have a baseline mini mental exams done and then done on a yearly basis. This is a test that requires a baseline and will pick up on cognitive changes over time. Very few primary care physicians utilize the St. Louis University Mental Status Exam. This is a test that will identify mild cognitive impairment on the first visit, and it does not require a baseline. I recommend that at your first visit, you ask for a referral to a neurologist or a neuropsychologist. They can do a complete cognitive workup. These tests assess the thinking abilities of the patient. They will assess memory, focus, and decision-making skills. Some seniors feel anxious when they are tested. Most physicians are empathetic and considerate as they discuss concerns with their patient and their family members. Don't use your fear of being tested as an excuse to get a diagnosis. There are many different types of tests to assess cognitive abilities. There is the animal naming test, the clock test, the Cognostat test, the St. Louis University Mental Status Exam, and the most commonly used test, the Mini Mental Status Exam. I have covered these tests extensively in past lessons. If you would like to learn the pros and cons or review the tests, just check them out at caregiverrelief.com. Just type the test you are interested in learning about in the search bar on Caregiver Relief's site. Your primary care doctor may determine further testing of your brain health issues is necessary. This may include brain scans or a psychiatric evaluation to rule out mental health disorders. As you see, is dementia a mental illness is a very good question, one that will be debated for years to come. Mental illness and different types of dementia are intertwined. If you are experiencing any problems with memory or you have had a change in mood or personality, it is important to discuss it with your primary care physician. There are many tests to determine if a person is suffering from a mental illness or if they're suffering from dementia. And there are times when a person may have both at the same time. Your PCP can help determine if there are additional factors that need to be addressed to determine appropriate treatment. Early diagnosis and treatment for dementia can slow the progression of the disease. It can support a better quality of life for a longer period of time.
Thank you for watching. Don't forget to hit that subscribe button and ring the notification bell so you never miss an episode of Caregiver Relief. If you have any thoughts, ideas, or suggestions for future videos, topics you'd like us to cover, or even improvements you'd like to see on the channel, drop them in the comments below.